Well, as I said, let's proceed to the opening plenary session entitled Women Leadership, Agility, Responsiveness and Resilience in Combating COVID-19, which will be led by Deborah Bowen, President and CEO of the American College of Healthcare Executive and President-designate of the International Hospital Federation. This session will be featured by Dr. Sarah Barbell, Chief Executive of the Barcelona City Council, and Lucy Nugent, CEO of Tallaght University Hospital in Ireland. So I would like to ask to Deborah Bowen if you could come upstairs, come up on stage, and we will start with this plenary session. Yes, here, please.
Yeah.
Thank you very much.
Thank you very much. Hello, everyone. Thank you, Helena, and thank you for the invitation to be here. What great, inspiring words. Are you energized this morning, I hope? Yes, wonderful. I want to thank all of our distinguished great speakers for their words of encouragement. And again, talking about courage, our session today is about women leadership, agility, responsiveness, and resilience in combating COVID-19 and many other things. And it's great to welcome all of you to this opening plenary of the 44th World Hospital Congress. I'm already in love with the city, so that won't be a problem for me. And again, I'm looking forward to this time with you. Now, even though the session is about women leadership, we need and want the men to stay. So hopefully you will do that. We're going to hear from some great women this morning, and the session will happen in two parts. We're going to hear from a very distinguished person here, right here in Barcelona, who I will introduce to you in a minute. And then we're going to let her do her speech, and then we'll come back, and Lucy Nugent and I will have a conversation. We'll invite you into our living room to have a little conversation. So why are we talking about women in leadership this morning? Well, obviously, equity of all dimensions has really been in the spotlight, and for very good reasons, as many of you know. Disparities and inequities in care, they exist and they are real and they are heartbreaking. So they've been further amplified by COVID, and certainly that's not acceptable. We also know that there's some evidence to suggest that diverse teams drive performance and drive quality in our hospitals. And yet, we also know that many of our boards, our management teams, don't represent the communities we serve. In fact, if you consider, and Dr. Clune noted this as well, 70% of the 43 million healthcare workers are women, but less than a third are in senior leadership or CEOs. So again, we're here today to learn, to explore, to understand how gender equity can be supported. It's my particular pleasure and privilege to introduce to you the female speakers, and I'm going to begin with Dr. Sarah Barbell Sanchez, who holds a PhD in social psychology, so she's well equipped to educate us about all of this. But that's not all she does. Alongside her position, she is Chief Executive of the Barcelona City Council, and I'm sure that's a challenging job. So obviously, we're looking forward to hearing from you, Sarah. She is also an accomplished expert, not only in leadership, but in empowerment and political practice for women today. And she's authored many books. The most recent one, I believe, is called Unbeatable, The Age of Women. But look her up, she's got several others. And she'll be providing to us an academic perspective on COVID-19. And as I mentioned, after her talk, we'll come back, and Lucy Nugent and I will have a conversation. And Lucy is the Chief Executive Officer of a prominent university, Tallaght University Hospital in Ireland. So Lucy will share with us some of her perspectives about women in leadership, and perhaps also how men have helped us as well. And again, we're looking forward to this time with you. So with no further ado, let me invite Dr. Sarah Barbell to the stage to give her address.
Good morning. Nice to see you. Nice to see you. Good morning. Okay. I was waiting for the presentation. Good morning. And thank you very much to the organizers of the World Hospital Congress for inviting me to share this time with you. During my presentation, we will analyze the basic aspects of leadership necessary to obtain better organizations and face complex emergencies. And we will see that role women can play in this new paradigm. We will analyze the main factors that hinder access to decision-making positions from a scientific perspective. Specifically, I'm going to focus on 4 factors, and I will end by proposing a successful strategy for women's equality and for improving our organizations, because deep down, both things are closely linked. First of all, let me introduce you to our city and some of the facts that describe it. Welcome to Barcelona. Benvinguts a la nostra ciutat, Barcelona. Here, you can see some of the figures that describe our city. Barcelona, as you see, is the capital of Catalonia, with more than 1.6 million inhabitants. The 90% of the workforce that we have is in the service sector. This is one of our main characteristics. And the number of workers in your sector, in the health sector, is more than 71,000 workers. And that means 23.5 per 10,000 inhabitants. So if you go to look how many companies, how are the companies that we have, then you'll see that they are very small companies, because 95% are fewer than 10 workers. So they are micro companies. Yes, this is the network of our empresarial net here in our country. Well, here you can see our mayor. Well, you've already seen her in the first opening session. Yeah? Ada Colau is the first woman mayor in our city and became so in 2015. It's been a historical fact. And here, when I joined as chief executive 2.5 years ago, my first action was to balance men and women in decision-making positions. Excuse me, I'm going to. In decision-making positions, 20 male managers and 20 female managers. Also a first. In the history of our city council, the management team had always been, surprise, surprise, overwhelmingly male. This is a major and historical change that we have achieved. And now, let's get down to details. We could begin as if we were in a story. Once upon a time, a terrible pandemic arrived, which devastated lives and expectations, which generated panic and anguish, which has kept us all in suspense until today. But like all stories, it also had some lessons for us, some morals to the story. We have shown that cooperating is better than competing. We have felt the urgent need for contact and love. We need to touch and hold each other. It may be ironical that during a pandemic that demanded social distancing, what people really needed was a good hug. And we have seen that the classic command and control does not work. Complex crises such as COVID or the climate emergency are not solved with direct orders, aggressive communications, or strict hierarchies. Instead, we have seen how leaders like Jacinda Ardern, the president of New Zealand, Tsai Ing-wen, the president of Taiwan, Ursula von der Leyen, or Angela Merkel triumph from humility, recognition of expert knowledge, and closeness to citizens. Do you think that we need to return to conventional command and control when the crisis finishes? What seemed like an intuition is being confirmed with the first scientific investigations of how a complex crisis is faced. In an excellent report carried out by the Emergency Governance Initiative, including the London School of Economics, one of the 10 principles includes the governance of empathy to ensure collaboration, co-creation, and caring as part of emergency responses. And I'm sure that you, all the people that are in this room, you have experienced it in your organizations. Here you can see that to tackle complex emergency, we propose the governance by empathy. Not only us, but the London School of Economics and the International Governance of Local. You can see it consists on the 3 C's of the new management. I mean, collaboration, co-creation, and caring. In addition to working non-stop at all hours and containing the emotions of your teams, you have undoubtedly had to manage in a cross-cutting way. I'm sure of that. Spreading power, sharing leadership, explaining a lot and carefully, and listening, understanding, and also smiling, even if it was through tears. That means, more than anything, that you have governed with empathy. You will have read that this type of leadership is associated with women, and that is why the term feminine leadership has been coined. However, is it exactly like that? What is the truth? I would like to begin by stating that social labor conditions, such as those that involve inequality, for example, having a higher level of unemployment, receiving less money, being more dissatisfied with a professional career, all these conditions affect the health and well-being of women, and of course, directly affects in their chances of becoming leaders. Here you can see the economic factors of inequality. The horizontal segregation, we'll talk about it later, and the vertical segregation as well, and then the salary gap. And what's more, we all know that women are the ones who suffer the most from anxiety and depression in our society. In addition to biological factors, I'm sure this is in part due to the inequality they suffer. We've got some studies about that too. Here, in our country, among the population aged 15 and over, 32% of women have suffered at some time from anxiety or depression, compared to 16% of men. So exactly the double. COVID has not helped to improve this, but quite the opposite. 3 out of 4 women suffered anxiety or depression during the lockdown. The direct impact on the business world and organizations of this economic equality that we have seen, it can be seen everywhere. An example of this is that in large congresses, such for example the Mobile World Congress, only 7% of the speakers were women in 2019. Look at here. 7% of the speakers were women. Can you imagine the majority sex of the attendance? I'll give you a clue. Well, yeah, you are right, unfortunately. It's 98%. 98% of the attendants were women. Now, things are changing, yes, but very slowly. This basic inequality already hampers the possibilities of leadership. But there are more obstacles. Let's now look at 4 aspects related to the leadership of women. We'll talk about differential socialization, vertical segregation, feminine leadership, and then the new and transformative leaderships. So we are going to start at the beginning. When we are born, we are not born isolated, but we undergo a process of constant socialization. Our family, our school, the group of friends, and so on. But this process is not neutral, as I will try to show. Here, in the differential socialization, as you know, each society interprets the fact to being a woman or a man according to their cultural characteristics. In some countries, patriarchy is still expressed in its utmost crudeness with, for example, selective abortions for women, or where a woman is murdered every hour. In Western countries, patriarchy has adopted more subtle forms, such as differentiating boys from girls according to clothing and color, or offering different toys. I'm sure that when you go to a department store, you always know which aisle is for girls and which aisle for boys. It's easily distinguished by the colors and the type of toys. Here you are, very easy to distinguish. But I have good news. California has become the first US state to require large retailers to display toys in gender-neutral ways. And some brands of toys, like Lego, have announced they will work to remove gender stereotypes from its toys. This cultural construction of a psychological type is what we call gender. It can therefore be learned, educated, changed, and manipulated. It's not set in stone. This socialization does not happen only during childhood, and this is very important because we cannot relax, because it continues into adulthood. And in fact, it guides our professions and the positions we can hold. It's essential to detect it, become aware of it, in order to deconstruct it. Take a look at these examples that I'm going to show, and think, please, while you see them. Does it seem to you that someone will think of a woman for a position of power? Look at here, an advertising. Excuse me. Here, they both are waiting for the metro, but one of them, the man is reading, and she is using her lipstick. There's a difference here. In this other, here, the man is intelligent if he doesn't littering, but by the same action, the same exactly, she is pretty. So we are telling how are men and women. This is adult socialization. And now I've put here one, sorry because it's in Spanish, but now I'm going to translate it to you. This is one of the major magazines for professional women, Cosmopolitan. Look at the stereotype. Here it says, if you are a woman and do the housework, you will also improve your facial skin. The two feminine commandments that have been passed down through generations, caring for the home and beauty. These are two for the price of one. Well, so we need to be very alert to this adult socialization. The second aspect I would highlight is vertical segregation. This differential education leads to the glass ceiling. It's built with stereotypes, prejudices, and the social structure itself. These stereotypes are generated from childhood, as we have seen, and there is their image when we are adult. Look at this. In Spain, the nursing profession is occupied by 98% of women, but when their representatives meet with the government, then again, we only find men. That's the first picture. And I know that is similar in many European countries, as you can see in the second picture. And then, if you want to see another kind of glass ceiling, here you have the image of the European Council, this time on screens due to COVID. Make the test. How many women can you see? It's rather hard to find them here. This glass ceiling, as you know, has to do above all with social and structural factors, but also with personal and psychological factors due to the differential education that women have received, including multiple prejudices in front of power. Here you can see many women think that power is synonymous with selfishness. They feel as, oh, I'm thinking of myself, when society asks me to always be altruistic and think only of others. Or they think power is destructive and that will end up destroying me, destroying my family, and leaving me completely alone. These are feelings that a lot of women have. That's the image of powerful women in movies and children's stories, if you remember. They end up alone and destroyed. Therefore, a new approach to power is necessary. For all of these reasons, despite those who say that women are already in all the places, or don't worry, time will give way to a greater number of them, you only have to look to the previous photos that I have shown to realize two premises. One, being voluntary does not work. I will give just an example. Do you remember the European Commissioner Viviane Reding? Here she is. In view of the low proportion of women in decision-making positions, she proposed in March 2011 to European companies to sign a voluntary agreement to increase the presence of women on boards of directors. A voluntary agreement, yes, to all the millions of companies in Europe. She promised to review the result a year later. So, in March 2012, she found, with utter desolation, that in the whole of Europe, only 24 companies had joined the initiative. In the whole Europe, only 24 companies. This is a clear example of the so-called glass ceiling. Now, in 2021, we are not much better than then. Therefore, being voluntary does not work. The second premise is the belief that time will fix it. For many people, there is hope that little by little, equality will be achieved. But we shouldn't fool ourselves. We will need more than 200 years to achieve equality. But I didn't say this. This was stated by the International Monetary Fund. That is to say, we'll achieve equality in 2020, if we are lucky, of course. I don't think many of us in this room will be around to witness it. This is the first thing. But anyway, we shouldn't have to wait 200 years. In short, time does not fix everything, and being voluntary does not work. So we have to act. We have to act forcefully. a third aspect that should be mentioned is feminine leadership. Just a few months ago, in a social psychology class, a colleague, well, in fact, he's a colleague, but it's my husband that is a university professor, had the opportunity to do an exercise on the self-concept of 80 female students. The results were surprising, you'll see. When making a conceptual cloud of the group class, he verified that they absolutely fit the stereotype of what a woman should be. You can see it here. The main adjectives with which the young women defined themselves were, in this order: cheerful, empathetic, sensitive, funny, responsible, caring, and understanding. It's curious, very curious, that bravery, ambition, rebellion, initiative, independence, and tendency to risk were not mentioned by anyone, not even among the least cited adjectives, no one, when it's obvious that everyone, all of you, know women that display these traits, fortunately. But from a part of society and also feminism, this so-called feminine leadership based on these feminine traits, classical feminine traits, is good for society and a cultural change. The hypothesis is that women will implement more cooperative, sensitive, and sensible management models. Every day we see congresses based on these premises, where the fact of being a woman ensures the difference in the management style. However, it's not taken into account that many women possess masculine characteristics without the need to convert by themselves, given that the most common thing among human beings is to possess masculine and feminine characteristics at the same time, although we repress some of them. If we are women, we repress some, and if we are men, we repress other characteristics. But the most common thing is to possess masculine and feminine characteristics, of course. The situation leads to an impossible dilemma, the dilemma of the double bind, quoted by the investigator Kathleen Hall. The dilemma of the double bind, according to which when women adopt the masculine stereotype, they are considered competent, but not liked. However, when they adopt the feminine stereotype, then they like them more, yes, but, they are not considered competent. That is, our margin of action is very narrow, since we are damned one way or another. So, what is true, therefore, in relation to female leadership? As I pointed out at the beginning, during the pandemic, there have been speeches regarding the good performance of women. Empathy is usually highlighted as typical of women. Here, you can see, for example, countries with female leaders fare better in the early stages of the pandemic. Female-led countries locked down more quickly than male-led countries. And the third, and pay attention because now we are going to talk about it, during times of crisis, stereotypically feminine qualities such as empathy and concern for others are coveted leadership qualities. Think crisis, think female. However, in studies carried out by scientists, although they detect some differences in the leadership style between men and women, these differences are not very relevant. They are very small and fundamentally due to differential education. In fact, the differences found seem to be subject not so much to being a woman as to many other variables such the type of organization, the preeminence of men or women at the organization, in the workforce, the methodology followed in the research, and even the sex of the researchers. Furthermore, we must be careful and be alert, since it seems that crises contribute to the consolidation of female leadership. This think crisis, think female. Crisis situations appear to lead to greater access for women to organizations that are or have been at serious economic risk. Maybe you remember when Iceland nationalized 3 of its large banks in 2009, which had fallen into bankruptcy due to the financial bubble, it placed women in the management of 2 of them. Maybe you remember. We lack female leadership. The newspaper, El País, headlined the news that year, while the New York Times coined the famous phrase according to which Lehman Brothers might have fared better as Lehman Brothers and sisters. Do you remember? You can see for yourselves in these newspapers, women, women, and women. However, the scientists were struck by a question. Could it not be that there's a tendency to reserve the worst positions for women or those in which there is a greater risk of failure? This is a very significant question. This is what has been called the glass cliff. The University of Exeter is one that has most studied this. The glass cliff, it would be a second discrimination, the contrary in a certain way to that of the glass ceiling, but equally damaging to women's leadership. This data should help to review the optimism with which the premise that crises favor women is accepted. Therefore, we must be alert to the centrality of female leadership, because again, it leads us to a stereotype that takes away our freedom, since we are forced to be as we are expected to be. And again, there are the typical, traditionally feminine characteristics with no space to women who are or feel different. This does not interest us. Finally, returning to the 4 aspects I mentioned, the 4th is the leadership, the new leadership for equality. Now we are going to talk about the type of innovative power that will improve our organizations, whether carried out by women or men, towards another model of leadership. Here you can see that traditional power has been the hierarchical one person over the others, ordering, commanding. But innovative power is spread, shared among equals who develop different leaderships in a team. Even an inner power over ourselves, it's necessary. And it has been shown to work. That's good news. Here you have some classic and traditional leaderships. You can see here Bolsonaro protesting against masks for tackling COVID-19. This is an authoritarian, classic, and traditional leadership, put in the extreme, but it's like this. Here you can see another authoritarian leadership. Here, Donald Trump with victims of I think that he was victims of shootings. Here, Donald Trump expelling a journalist. Here, Donald Trump was asking a child if he still believes in Santa Claus. So this is clearly a traditional and authoritarian leadership. But we have other kinds of leadership in men and in women. You can see here the historic visit of Obama to a prison of Oklahoma. It was the first time in the history that the president went here. You can see his attitude. He is listening to the prisoners at the same level of them. Well, you can imagine. This is a new leadership, a not classical or traditional one, an empathetic leadership. And here you can see Jacinda Ardern, the Prime Minister of New Zealand, after the attack on a mosque. You can see an empathetic leadership, humble and respectful towards diversity. So we can choose what kind of leadership we can do, and we can choose because the effects are absolutely different between one or the other. So the new transformational leaderships are shared leadership, joint management, ethical leadership, network leadership, and also based on vision and introspection. This part of introspection is always important in a person that is a leader. It's fundamentally. So, to sum up, to finish, to summarize everything I have said, so as to achieve innovative and egalitarian leadership, it's necessary, above all, to not be afraid. This is the first. Please, don't be afraid to carry out positive actions for women. Remember that voluntary doesn't go. So, temporary quotas, making neutral selections, implementing equality plans and of reconciliation for work-life balance. I assure you that workers will be motivated, the level of absenteeism will decrease, and your profit and loss account will also be grateful. Don't fear power. It's fantastic if it allows us to change things, share happiness, sadness, and decisions with your colleagues. Be creative. You can be inspired by new leaderships that make everyone happier. Build networks, especially women who tend to feel very alone in the world of work. It will give them strength, joy, and many ideas for improvement. Organize working time better so that everyone can allocate space to their lives. Personal fulfillment, time with loved ones, the cultivation of reading and art, friendship, are as necessary as work for our survival. Be daring and bet on collective empowerment. Adding is always more powerful than subtracting. Together, we can break prejudices and stereotypes, but isolated, it will be impossible. And please be proud of women from yesterday, women from the past, and the women today that are practicing new leaderships. So, thank you very much for your attention.
Thank you very much. It was a great talk. Let's give her another round of applause. Thank you. So, I want to invite you into our living room. This is Lucy. We're going to have a conversation now about some of the things that you might have heard from Sarah, and of course some of the things that resonate with you, Lucy. You've been a CEO for how long now?
Since January 2019.
January 2019. Yeah. What a time to start your role. Yeah. And did you always want to be the CEO? I mean, was that something that was
Absolutely
on your
not.
mind?
No. Was not on the game plan at all.
Oh, well, tell us about it.
So I started off as a nurse. So as a young 18-year-old, I thought the height of success was if you got a bleep. I eventually got a bleep and realized it was a curse. So, no, really, I was very happy. I had 3 young children. I was working part-time. So, no, it wasn't on the plan. But then I went back to college and I did a degree part-time. And it kind of opened up my mind. And I'm a big fan of lifelong learning, whether that's an academic program or a conversation. you know?
Yeah.
So there was a job in the hospital I was working for in operations, and I kind of said, sure, look, I'll throw my CV in. I probably won't get shortlisted, but I'll give it a go. I got shortlisted, did the interview, got the job, so moved away from nursing, which was, you know, a little bit of a unsettling time for me, because in nursing, there's a great support structure around you.
Yeah.
So yeah, so I went through various different operations roles. Then I went to the current hospital that I'm now the CEO of as the Chief Operations Officer. 2 years later, the opportunity came to interview for the Deputy CEO role. And then 2 years later, the CEO left, and I was fortunate enough to be appointed.
That's wonderful. Congratulations. Now, as being a nurse, do you think that was an advantage?
I think it has pluses and cons. In the beginning, certainly, because I had clinical knowledge, I knew if somebody was, you know, maybe spinning me a yarn as to why something couldn't be done. But I suffered a little bit of an imposter syndrome. Nursing is a very hierarchical structure. So, you know, coming out of that is, well, you know, am I good enough? That was a question I asked myself in the beginning.
Yeah.
And
how'd you get over that?
I think through making mistakes, from learning from the mistakes, from asking for help. I'm a great believer in having a network of people, both in your personal life and in your professional life, that you can say, what do you think of this? I certainly, I feed off the energy of other people. So I think over the years, my confidence has grown. I was in the job as CEO for six weeks when we had a nurses' strike. It was a national strike. So I went, okay, it's not local. And I went, okay, this is going to be the first test of my leadership.
Yeah.
And I remember going to meet the nursing unions, and I said, look, it's about pay. And I could understand a new graduate nurse gets €25,000 in Ireland. A graduate engineer gets 50,000.
Yeah.
So I could understand why they were frustrated by the pay scales. And I said, look, this is a national issue. It's not a local issue. Let's try and work together, because when it's over, we're still going to be working together. And I think taking that upfront approach worked in that situation.
Yeah, being direct. A lot of the ideas I think that Sarah was talking about this idea that you've been socialized a certain way, so you don't feel you could do something, you don't feel you can achieve something. I know the same was true for me when I became president of ACHE. I had to work with a coach for 1.5 years before I really saw myself in the role, and I think if you don't see yourself successful, you can't really be it. So you had a plan. Obviously. Tell us a little bit about the plan. Who was a woman more helpful, a man? Did you have a mentor? Tell us about the plan.
I suppose reflecting and preparing for this chat, I look back and realized that actually I had mentors. I just didn't realize they were mentoring me. Whether it was, you know, I had an aunt who took great interest in my career. She was a nun, and nuns are very direct as well. And actually, Jerry O'Dwyer was here yesterday. I only told him last night. I realized has been a great mentor to me. I joined the local National Association of Hospital Managers, and he saw something in me I didn't see, and would quietly say, you know, would you not do that? And have you thought about taking that opportunity? And I've developed this saying, well, I will say yes to every reasonable invitation. I didn't think that last night when I couldn't sleep thinking about this. But I do think if you actually stretch yourselves, not to the point of breaking, obviously, but come out of the comfort zone, you'll take something positive or negative out of it that'll help you grow.
Yeah, sometimes you have to fail to succeed. I think that's true. This idea about network, Sarah talked about it a little bit too, network leadership, and this idea of teaming, and this idea of really working together to find new solutions to things, I think is really important. And I think here, in avenues like this and in environments like this, we have great opportunities to share and to learn together. And so I think that's going to be very helpful. Was there one particular particular skill that helped you during the pandemic? Was there one thing that you sort of went, I think that's kind of the secret sauce that is really helping me navigate through this?
Look, like everyone else in the room, when the pandemic hit us, you know, it was the fear of the scenes of Bergamo in Italy and Wuhan. And I kind of said, okay, you know, the information we were getting out nationally kept changing, and that's okay. And I heard a phrase that actually resonated with me, which is confident humility, which is you have to make a decision based on the best evidence you have to hand, but have the confidence to change it as needed. And change is actually a strength, not a weakness. And actually, that's how the body of scientific evidence evolves, is by actually changing things. So it was to be decisive, but also to change when and redirect when necessary.
Yeah, I know in the States, everybody kept talking about the importance of being present and communicating, not only inside the hospitals, but outside with the communities. Did you find yourself doing a lot of that?
Yeah, no, we did a lot of that, and we're very lucky. Where we are is a suburb of Dublin called Tala. The community have always felt that they own the hospital. It's only 23 years old. It's actually the newest built hospital in the country. It was a merger of 3 hospitals. So we got huge community support. I mean, I put on the COVID stone. I lost it. I put it on again with each wave. But we got great support from the community, but we also needed them to support us in their own behavior. And they saw us as a trusted advisor. So even things like, you know, don't be afraid to come to hospital if you need us. We are here. And then staff. I mean, it was so essential that staff felt that they could trust myself and the executive management team that we were going to make sure they had PPE, that we were going to make sure that they had enough staff. And that was a challenge, obviously, because, you know, over 20% of staff got COVID, you know. So it was about trying to communicate what we knew as soon as we knew it and what we were doing. And I think that definitely, you know, was it perfect? No, because I know there are people who don't read my emails, but you know,
no, really?
Yeah, oh yeah. But I walked the corridors, and I felt, well, you know, look, because actually, the one good thing was, you know, there was we spent a lot of time going to meetings and sitting on groups, and they're all very important, but we wasted a lot of time in the getting of there. So I found I actually, you know, I had time to walk the corridors to see is everything okay, and just to make people feel that they knew I was there with them. You know, obviously they were taking, I mean, the heroes in all of this are, you know, the real frontline staff.
Yes,
people who are
totally agree.
putting on the PPE, putting their lives at risk. And I actually found that was, I'm a tough old bird, but I got quite emotional when I stood in front of a group of nurses and the medical board to say, you know, what we were doing. And they saying back to me, we know that the majority of us in the room are going to get this. But we're here and we're ready. And that was so humbling.
Yeah, well, I think you mentioned a couple of things that I think are really important, and one is trust. And obviously it's difficult to build trust during a pandemic. So that idea of everyday listening and learning, rounding, making sure you're present, making sure you're listening well and following through, I think is so important. You know, we're going to shorten our session a little so we have time for a break to do the networking that we know is so important. But I'd like to ask you, Lucy, for the benefit of both the men and the women in the room, what particular advice do you have for those who are thinking about taking that next step in leadership, or maybe who are new to leadership, or maybe not so new to leadership? You know, what are those kind of true norths that keep you going, and what advice can you leave our audience with today?
I think, you know, to thine own self be true rings with me, and that you have to be authentic. You can't be something you're not. You can work on yourself, but in the early days of being a CEO, I tried to mimic the behavior of my predecessor, who was quite dictatorial. That is not my style. So I had to learn to be me. So I think to be authentic, I think to take an opportunity, big or small, to be brave, and to find your voice. Because everybody has a contribution to make, and we can all learn from each other.
What's inspiring to me is just this whole idea that the teaming, the transformative things that are really helping us are really those sort of softer skills, right? Collaboration. You know, I had a former boss who used to say people never get fired for not being able to do an Excel spreadsheet, but they do when they don't build their relationships the way they need to. And so those transformative powers that can really help us all are really very evident. All we need is the courage to follow through. So you've been wonderful. We're going to take a little break. But before I do that, I want to thank Sarah again for her wonderful keynote. And also to you, Lucy. You know, I've known you for many years, and it's great to see you advance and thrive and be the leader you are today. I also want to mention that the International Hospital Federation is starting a Women in Leadership Forum, and we're going to have a breakfast on Thursday, and we look forward to our role in really helping women and men around the world really advance gender equity. So I want to thank you all for coming. I hope you'll enjoy some of the break today. And again, enjoy the Congress. We look forward to meeting many of you, and thank you for being here, Lucy.
Thank you.
Be well, be safe. Thank you. Very good.
Thank you very much, Deborah, Sarah, Lucy. It was a pleasure having you here in this first plenary session. Now, time for all of us to take a rest. So take your time to stretch your legs, to grab a coffee. Of course, time for networking. And see you in 10 minutes. Thank you very much.